I wanted to increase right side flexion on the right side at the U-joint. So what I've got is basically the right joint is stuck superiorly. We'll say it's C3-4. Is that okay? So forgetting all of the fancy stuff, let's assume I've got a problem above it that doesn't allow me to thrust down onto it. Because that would be my preferred technique when it's coming down. Top, pushing the top one down off the bottom one. But I can't do that because I've got a problem actually below. Alright? So I've got two ways I could possibly get out of this. One is to lock below. And you'd have to, God knows how you do that. You're older, it still would have to turn underneath it, I guess. But the other one, of course, is to thrust from below. So I take the pressure off the segments below, so I'm not going to get it done this way. So in simplest terms, then what it will consist of is me taking C4 and pushing C4 on the right up. Yeah. Now I need to set this up, so I've got to set this up either with translation of C3 to the left or translation of C4 to the right. Is that okay? One or the other. And if you think I'm making this up as I go along, you're right. So, now, if I do this, keep it neutral, translate C3 to the left, thrust C4 up, that would work, wouldn't it? And then the problem I've got now is translating C3 to the left. Any thoughts? Because I'm really going to be like this, I think, aren't I?
You side bend, right?
I've got a side bend right, but I've got to get that side bend right. That's the point, isn't it? I can come this way, can't I? Take the head, flex it, leave it neutral, whatever I want to do. But if I basically translate everything across that way, there, that will translate C3-4. And then come and do that. Let's try that one first, yeah? Let's see what happens. So, I have to open the thing up so I can get underneath C4 and there. Now, that will translate. If I do that with him, that will translate it. Okay? Relax here. Yeah, that's about the only way I can do it from this position, I think. Translate over that way, and then basically thrust. If I really want to make it fancier, then I'll lock the joints above. So if I've got a problem going on above as well as below, then I have to lock them. So, flex them. Now I'm going to have to, there's no point in me doing this side bending AO, AA, C2-3. Is that when I want to take C3 the other way? It wouldn't work, would it? So what I need to do is basically side bend in this way, there. So AO, lock it, rotation. AA, we'll translate it, lock it, rotation. C3, translate it, onto C4, and thrust. Yeah? Shitty technique. Let's see if we can figure out a better one to do it. So is that okay?
The AA lock, how are you doing that again?
Rotation.
Just rotate.
Rotation translation. So you're doing that, but it has to be that, that.
That has to be in the same motion as AO.
Yeah, it really does, because you've only got one hand to do all this with.
Yeah.
I mean, if you can do different, then do different, but you're going to have trouble because you're trying to control everything via the head. So for me to do that and then rotate something else in the other direction. Yeah.
Unlocking.
It's really about practicalities more than anything else.
Good.
In actual fact, the easiest way of doing this is to do a neutral lock, which is what we do in the lumbar spine all the time, isn't it? It's basically you squidge everything in there, and that's pretty much locked now, isn't it? But I can't describe that to you, and you won't be able to describe it in the exam. But it basically is a neutral lock. You've just taken up all of the slack in a sort of non-specific manner. And actually I think they're the best locks because you keep everything in neutral. Okay? So if we're doing this for the U joint, how do we do the facet joint? Well, we can certainly manipulate the translation. Cool, we're not worried about the U joint, facet joint or anything else, just manipulate the translation. So let's say I wanted to, let's say I'm missing flexion, right side bending, left translation at 3-4 again. Right? What we'd normally do basically is flex it, translate it, thrust it. Yeah? Well, that's fine, we can do the same thing, but it's going to be awkward. I'm going to lock down because it's a locking technique, so I've still got to lock everything down. And I can lock this in flexion or extension. Flexion's the easiest. So we're locking flexion, and I'm doing it from the bottom again. So what I'm going to do is I'm going to push C4 to the left because I want C3 to go to the right. Yeah? So I'll change hands. So I need to basically lock everything down. I'm just thinking about the best way of doing this. I want this segment at its barrier. Or I can get that by pushing C4 across. So I don't have to worry about the translation. But I do have to lock AO, AA, and C23 there. Come on to C4, take up the slack, and thrust. Yeah? That's very simple, and that's from the bottom. From the top, I'd be on this side, wouldn't I? Basically, it's the same as we've already done, except we lock everything in place. We'll make it look more fancy. You can come in and do this with it, and then thrust across that way. Yeah? So that's easy, it's the ones from the bottom up. Is that okay?
Your thrust was translation?
This is a translation there. Yeah. Does that make sense? Alright, so go and do the U joint. We'll keep it simple. Right side bending, ipsilateral joint, and then C3-4 for flexion.